Hi, my name is Lisa Gonzalez, and I'm a nurse educator. I teach in the clinical, classroom, and lab for Medical Surgical 2 course and an associate degree nursing program. I wrote the blog, A Nurse Educator's Resolution, Putting First Things First, at the end of 2022, thinking ahead about the coming new year. So many of us start our New Year's off with good intentions, grand plans, and a New Year's resolution. But that can fade over time or never amount to what we expected. I started to think about my own journey in nurse education, which I also shared in the blog. The baby steps I've taken over time and the lessons I've learned along the way. What I've learned is that making small changes over time can have a great impact. Small changes tend to be more sustainable and are more realistic to obtain. What's so important, though, is that we're willing to move forward and make those changes. And we must. 2023 is a big year for nurse educators. This is the year of the next generation NCLEX launch. Are we ready? And what small change can we implement now that can prepare our students for success as they prepare for next gen and the demands of nursing practice? We know that clinical judgment is an essential part of nursing practice and will be better reflected in the next generation NCLEX. But we also know that our new graduates struggle to use clinical judgment. So what can we do to ensure that students are prepared to use clinical judgment on the NCLEX and in their practice? What small change can we implement to work towards these goals? I firmly believe that this begins with us, the nurse educators, working with our students and with the time we spend investing in our own knowledge base. Clinical reasoning and judgment can be seen as a skill set that we teach our students, and we can do so piece by piece. But we must make sure we've taken the time to dive into what clinical reasoning and judgment entails, that we understand the difference between the terms and how it's even different from critical thinking. Teaching critical thinking skills alone is not enough to develop students' clinical judgment. They need to understand how nurses transfer that knowledge and the skills from clinical reasoning into practice. In practical ways, what do nurses do in order to arrive at their clinical judgments? Once we fully dive into clinical reasoning, clinical judgment, and critical thinking, we can examine our current teaching practices. We can't expect to be as effective at teaching clinical reasoning if we are not intentional in our approaches to do so. So think about some different ways you can do this. How can we break down clinical reasoning into manageable pieces for students? How can we challenge their thinking and give them opportunities to apply these reasoning skills to patient scenarios, maybe ones that you present in class or in simulation, or even how they approach clinical reasoning during clinical? Learning can be a messy process. Let's be brave enough to try new approaches or reinvent old strategies, but with emphasis on clinical judgment. Maybe that means you integrate a clinical judgment model into your course through discussion or by providing a framework for a learning activity. Maybe that means you check out an article or two about different teaching strategies that can promote clinical reasoning or clinical judgment, such as a reflective writing assignment. Maybe we could try that out. Or maybe we can commit 20 minutes to the next nursing program meeting so that we can all share different ideas of ways that we are developing students' clinical judgment. Whatever it is, just one small step, one change, trying something new may provide the momentum needed to make a significant impact on our students' clinical judgment development. This is the year, nurse educators. Let's be brave. Take that next step and continue to make a difference in our students' lives and in nursing education.